Hi again, my name is Shane Britton. I'm back here at Granada Farms in Wheelock, Texas. Today I'm with my yearling friend Flint. In our last video we discussed feeding carbohydrates to horses and how horses utilize carbohydrates. This time around we are going to discuss a health-related topic that all horse owners must be familiar with, colic. In this video I would like to thoroughly discuss the definition of colic, the types, the causes, symptoms, treatments, and proper management practices to prevent your horse from colicking. Although colic is somewhat inevitable due to the design of the equine gastrointestinal tract and some of our horses' behavior, the incidence of colic can be greatly reduced through proper management. Things like feeding, environment, water availability, treatments, vaccinations, and deworming. Colic is simply defined as abdominal pain. The term colic is more of a clinical sign rather than a diagnosis, but colic encompasses all forms of gastrointestinal conditions which cause abdominal pain to horses. In other words, colic is like a symptom for a greater issue ongoing in your horse's GI tract. Colic is something that should be taken seriously no matter the conditions. There are several types and causes of colic. The list is pretty extensive, so we will only focus on the most common and the most severe forms of colic. Gas colic is the result of gas buildup within the horse's digestive tract due to excessive fermentation within the intestines or the inability to move gas through the GI tract. This is not typically fatal, but can cause a rupture of the GI tract if not properly and timely treated. Talk to a nutritionist or vet to discuss the type of feedstuffs you are feeding to determine why your horse is struggling with its diet. Your vet may insert a nasogastric tube to alleviate gas buildup and administer medication. Impaction colic can be caused by the impaction of food material, foreign matter like sand or wood shavings, or even parasite clusters in the horse's gut. The GI tract of the horse has many strictures and flexures where matter can become impacted. Displacement colic mostly refers to nephrosplenic entrapment, aka left dorsal displacement. Though there is a right dorsal displacement, nephrosplenic entrapment is when the left dorsal colon becomes trapped in nephrosplenic space. This space is found between the spleen, the left kidney, and the nephrosplenic ligament, which runs between the spleen and the kidney and the body wall. Torsion is a twist along the longitudinal axis of the large intestine, and volvulus is a twist along the axis of the mesentery. Intussusception is when a piece of intestine telescopes within a portion of itself because a section is paralyzed or necrotic, and the modal section pushes itself into the non-modal section. Think of this like when you take off a sock or a latex glove and a portion of the material folds or rolls over another portion. Horses form ulcers in their stomach, a disease called equine gastric ulcer syndrome. I went a little more in depth about ulcers in the carbohydrate video. These ulcers can begin and accelerate by the way we manage our horses through feeding routine, types of feed, amount of feed, stress, and NSAID drug use. If your horse is on a high starch diet, consider supplementing ulcer guard to prevent ulcers. Parasite clusters, most commonly roundworms, may be the cause of colic, but is really only seen with a heavy worm infestation. Where these worms cluster, almost like tumbleweed, tapeworms have been studied heavily, and some studies implicate them as a cause of colic and other studies exclude them. Many other types of worms travel through the GI tract and damage tissue and organs, so proper and timely deworming is crucial in preventing a worm infestation and colic. Foal colic is fairly common due to several reasons. Meconium, or the first feces produced by and passed by a foal, should be passed within the first 24 hours post-parturition. Meconium, being a hard feces, has a chance of becoming impacted. Their abdomen may also become distended due to gas and backup of feces. Enemas are commonly administered to aid the foal in passing its first feces. Watch your mare for postpartum colic as well. Every horse owner should understand healthy horse behavior, and more specifically their horse's normal behavior. Every horse is an individual and has their own personality, so they may display colic symptoms differently or just have certain vices that appear to be colicky, or the horse is just bored or fooling around. Nonetheless, as horse owners, we need to constantly be aware of colic symptoms or any symptom of pain. It is also important to know your horse's normal, healthy, resting temperature, heart rate, and respiratory rate so that you know when your horse's vital signs are abnormal. There are many symptoms of colic, as discussed earlier, but constantly be aware of the following: elevated body temperature, increased heart and respiratory rate, lack of gut sounds, overactive gut sounds, pawing the ground, licking or biting the flank, practically pointing to the pain, sweating, lethargy, repeated lying down and rising. This may become violent in severe cases. Rolling. When a horse gets up from rolling around, it should shake like a wet dog. If the horse does not shake, this is a sign that shaking causes some sort of discomfort. This can also become violent in a severe case. Teeth grinding and jaw clenching, also known as bruxism. Lack of appetite and thirst. Your horse should be hungry and excited to eat at feed time. Awkward stances may be observed. If your horse is standing parked out or has a narrow stance, they may be experiencing discomfort. If you notice abnormal colicky behavior, call a vet. If you can safely catch your horse and prevent them from rolling and twisting or displacing anything in their GI tract, do so. Do not administer any medications until your vet arrives, as the medication can mask the severity of the colic. Depending on the severity of colic, your vet may administer analgesics or anti-inflammatories. If products like Banamine aren't sufficient in treating colic, your vet may move on to other procedures like fluid therapy. In some displacement or twisted gut cases, a rolling procedure may be done with your horse to help the GI tract fall back in place. Laxatives and lubrications are also commonly used to aid impacted material in passing through the GI tract. In severe cases, your vet may need to move into invasive colic surgery. If your horse is a chronic colicker, your vet may suggest doing an exploratory surgery to understand how to best treat your horse. Earlier, I mentioned that as horse owners, we can do a lot of things to prevent colic and some of the syndromes causing colic. Always, and I mean always, provide clean and clear water source and free access to your horse. Horses are finicky, as we know, and if you wouldn't want to drink the water, they probably don't either. Providing water is helpful in preventing impactions and ulcers, and prevents dehydration, which is not helpful with a colicking horse. Avoid sudden changes in feed amounts and types, and change their diet by about 25% per day to allow your horse to adjust. Be sure to feed your horse off the ground or in a feed pan or hay net to keep them from ingesting dirt, sand, or shavings. Like I mentioned in the carbohydrates video, in a feral setting, horses eat small meals here and there. Their GI tract is not designed for the few large meals that we feed them in a domesticated setting. So keeping a consistent feeding schedule and providing plenty of time for them to digest their previous meal is crucial in preventing colic. Your horse should receive an absolute minimum of 1% of their body weight in high quality forage daily. Coastal Bermuda grass or any long stemmy grass does have a higher propensity for impaction colic, so keep this in mind when selecting your forages to feed to your horse. Coastal hay may not be the best option for a chronic colicker. Proper and timely deworming is crucial. This can prevent worms from causing necrosis or paralysis of tissue in the gut, which can cause GI issues and colic. Also, listen to what your horse is telling you. If they are ingesting shavings or tree bark in a pasture, they are probably deficient in a fiber, and you need to either provide them more hay when in a stall or even wrap your trees with wire to keep your horse from eating bark. Tree bark does not belong in a horse's gut. And finally, regular visits to the vet are crucial. Vets can examine your horse's dentition to be sure they are masticating feedstuffs properly. Believe it or not, vets understand how horses function best and display discomfort, and may be able to help you determine how to properly manage your horses. Thank you for watching, and I hope I gave you useful insight on horse colic.